Hello.
Shmai, Pranda Pawb. Good afternoon, everybody.
Right.
Pranda Pawb.
All right.
Newn ni aros ychydig yn rhagor cyn cychwyn. We'll wait a little longer before starting, because I know we've had about 60 people register, so we'll give people a chance to join us. Newn ni rhoi cyfle I bawb I... Pobl yn dechrau dod trwyddo nawr. People are starting to come through now, but we'll just leave it a few more seconds just to give everybody the chance. And I think we're waiting for a few more panelists as well.
Hello, anybody else there?
Richard, is that you?
It is. I've had to phone in because it won't let me in at all on the computer today. But I see lots of people are having problems.
That's fine.
Who's
that's
that?
Okay.
Oh, is that Hazel?
Hazel, Richard. So,
oh, good. Right. Yeah.
We haven't yet started the meeting, so we'll start in a little while as people join us. And Richard, I don't know whether there's probably not a mute button on your phone quite as easily.
Sadly not.
Yeah. So we'll restart in a little while. So welcome, Richard. We'll start in a little while just to give a few more seconds for people to join us if they've had any technical issues. Bod e'n bryd I ni cychwyn. It's time started. Felly, croeso I chi gyd a diolch I chi am ymuno am I prynawn yma. Welcome all and thank you for joining us this afternoon. We don't have any simultaneous translation this afternoon, so there isn't the option for you to pick up a translator, but we will be delivering the session bilingually. Mi fydd na ddim cyfieithu ar y pryd prynawn yma, ond mi fyddwn ni'n cynnal yr sesiwn yn ddwyieithog. Mae'r session hefyd yn cael ei recordio. The session is also being recorded. So if you know who wasn't able to join us this afternoon, then we'll be sharing the recording as soon as we can. Felly, y trydydd sesiwn gwybodaeth prynhawn yma yn ein cyfres. This is the third information session in our series. The first focused on buildings, the second on activities, and this afternoon we'll be focusing on people. Mi fyddwn ni'n canolbwyntio ar pobl, ar system profi olrhain a diogelu. And we'll hear a little bit more about the test, trace and protect process in Ceredigion. Felly, na i gyflwyno'n hunan i'r sawloch chi sydd ddim wedi bod yn cwmni ni cyn heddi. Fenw yw Ailagor a dwi'n gweithio i tîm Cafo a dwi'n cadeirydd ar y panel. I'd just like to introduce myself for those of you who haven't been in our company before today. My name is Ailagor and I work for the Cafo team. And I'm chairing a panel that's been brought together under the remit of the Ceredigion Public Services Board to support the safe reopening of community venues and the reintroduction of activities. Mae'r panel cael ei dynnu at ei gilydd o dan aden Bwrdd Gwasanaethau Lleol Ceredigion i cefnogi cyfleusterau cymunedol i ail-agor a i gweithgareddau i ail-gychwyn. And you can see in front of you, fe welwch chi o'ch blaen chi aelodau o'r panel. You can see members of the panel, some of the sharpest and brightest minds when it comes to health and safety and environmental health in, well, not just Ceredigion, Wales, I would say. So use our expertise and contact us. Many of you have. Mae nifer o chi wedi cysylltu â ni. So please continue to keep in touch and ask for the panel's opinion because we're here to support you. I ni ma i'ch cefnogi chi. Fi'n gwybod bod da ni cwestiwn yn dos i holi i'r sawl sy'n mynychu. We do have a poll, question poll, don't we, Manon, for those who have joined us. So that might pop up during the course of the session if the technology allows us to do that. Ond os bod chi am holi cwestiwn, if you do want to ask a question during this session, then please can you use the chat column and then we'll pick up on any themes and any specific questions if time allow throughout the afternoon session. Just cyn ni symud mlaen i'r cyflwyniad ar system profi olrhain a diogelu yng Ngheredigion. Before we move on to the presentation on the test, trace and protect system in Ceredigion. Just a quick update, a very, very brief update. We are still awaiting a further announcement from Welsh Government on Friday regarding the ability to allow and to support more people to gather indoors. But as you are all very, very aware, there has been a rise in cases across Wales and across the UK. And news was it very early on this morning that England had made the decision to reduce the number of people that could meet indoors from 30 to 6, if I remember rightly. So that might be reflected in Friday's announcement from Welsh Government. We will wait and see. Fel I chi'n ymwybodol, ni dal yn aros am datganiad o Llywodraeth Cymru dydd Gwener, ond mae nifer o achosion yn symud yn y cyfeiriad anghywir yn dywe ar draws Cymru a ar draws y Deyrnas Unedig. Felly, efallai fydd y penderfyniad sydd wedi cael ei wneud yn Lloegr i lleihau'r nifer o bobl sydd yn dod yn hyd tu fewn o 30 i 6 yn cael ei adlewyrchu yn unrhyw datganiad dydd Gwener. Felly, newn ni cadw chi nawn ni cadw mewn cysylltiad a rannu'r gwybodaeth gyda chi. We'll keep in touch and share information with you. Good news, the resources that we've been promising are now on the Ceredigion County Council website, and I think a link has been shared, and we'll continue to share that link. We are adding documents and video clips and pieces of information to that list, to that site regularly. Therefore, please go back and check. Mae'r adnoddau nawr ar gael ar wefan y Cyngor Sir. Mae'r link wedi cael ei rannu a byddwn ni'n parhau i rannu'r ddolen. Felly, ni'n ychwanegu gwybodaeth pellach ar yr safle yna. Felly, mae'n bwysig bod chi'n mynd nôl i cael golwg bob hyn a hyn. Fi'n gweld bod Owain wedi ymuno â ni. Fi'n siŵr iawn lle mae Edward. Pnawn da, Owain. Good afternoon, Owain.
Pnawn da, Hazel. Hello. Hello.
Hello. Felly, fyddwn ni'n clywed nawr o Owain a Edward ychydig yn fwy am proses profi olrhain a diogelu Ceredigion. We'll now move on to the presentation from Owain, and I'm not sure where Edward is, Owain, but we will now hear a little bit more about the test, trace and protect system in Ceredigion. So over to you, Owain.
Okay, yeah, well, diolch yn fawr, prynawn da pawb. Good afternoon all. I'll start the presentation then in English, but if there's any questions or anybody wants to interject at any point, happy to take questions in Welsh or English. But with this presentation, we hope to obviously introduce ourselves. My name's Owain Jones. I'm one of the operational leads for the contact tracing team in Ceredigion County Council. My colleague Edward Dumbrill is also hoping to join the this Skype call or Zoom call. So I'm not sure if he's having trouble getting in at the moment, but he should be joining us before long. We hope to introduce a little bit of the Test and Trace project and how that will sort of interlink with the community centres and opening of village halls, etc. So if I start off with a bit of a background to the Trace and Protect project, obviously transmission of COVID-19 is expected to continue until a vaccine is available or enough of the population have acquired immunity to protect against the virus and to stop it from spreading. The lockdown restrictions have had a profound effect on the lives of all of us across Wales and have also helped contribute to the falling levels of infection. The virus remains a very serious threat to us all, and we need to make the most of all the tools available to us to help avoid the risk of a second significant wave of infection. Contact tracing has been and is being used in countries all around the world to limit the spread of the virus in the community by breaking the link of transmission. Contact tracing starts with self-reporting of symptoms, followed by testing of the suspected cases and tracing the contacts of those who have tested positive, and then protecting our families, friends and communities through self-isolation. We work closely in the test, track and trace team in close collaboration with Hywel Dda University Health Board, Public Health Wales, Carmarthenshire County Council and Pembrokeshire County Council, and that forms what's called the Regional Response Cell, which is based in the Health Board St David's site and is staffed by both Public Health Wales and Health Board members of staff and is led by a consultant in public health. The Regional Response Cell acts as a link between the local authority contact tracing teams, such as the contact tracers and the contact advisors, and the National Health Protection Specialists that support from Public Health Wales. The Regional Response Cell is staffed again Health Wales and is led by a lead consultant, and as mentioned is a link between the local authority and the more national team. So I can see actually Ed I think's joined us. So Ed, can you hear me?
Hello, Bob. I'm sorry about the technical difficulties. Yes, I've managed to follow a separate link, and I'm now in to the presentation. So sorry, Bob. Fi sy'n mynd I cymryd lan yr ochr Gymraeg, so mae'n flin dy fi byddai'n mynd dros yr un sgript eto yn y Gymraeg y tro mas ydy hynny'n iawn.
Yn rhywun croeso, welcome.
Diolch yn fawr iawn. Felly, pwrpas y sesiwn yma heddiw yw I cyflwyno'n hunan, Edward Ymryl ydw I ac Owain Jones. Mae fi'n gyfi bod fi wedi methu dechrau'r presentation, so fi ag Owain yw'r ni sy'n arwain ar Test, Trace and Protect gyda ni yn Ceredigion. Ac fel rhan o'r cyflwyniad yma, I ni moyn cyflwyno'r system sydd gyda ni o oldrain cysylltiadau a rhoi cyngor arnoch chi gyd ar y gofynion ohonoch I casglu gwybodaeth unrhyw bobl sydd yn ymweld ar lleoliadau chi'n gyfrifol amdanyn nhw ac sut mae casglu gwybodaeth na yn helpu'r proses o olrain cysylltiadau. Fel bach o cefndir i'r system o olrain cysylltiadau, dath y system I fod achos bod trosglwyddiad o Covid-19 yn mynd I parhau hyd nes bod brechiad ar gael neu bod digon o immunedd o fewn ein poblogaeth I stopio hynny rhag ymledu. Mae'r cyfyniadau clo wedi cael effaith mawr ar y boblogaeth I atal y haint rhagledeini. A mae wedi cael effaith mawr ar bawb, ond mae hynny wedi arwain at lefelau isel o ymlediad yr haint. Mae'r virus yn parhau I fod yn fygythiad I pawb, felly bydd rhaid I ni manteisio ar pob offeryn sydd gyda ni I osgoi ail don o haint I ddigwydd eto. Felly, mae'r system o olrain cysylltiadau wedi cael ei defnyddio mewn gwledydd draws y byd I rhwystro lledaeniad yr haint gan torri lawr y cadwyn o trosglwyddo'r haint o un person i'r llall. Mae'r system o olrain cysylltiadau yn dechrau gyda pobl yn hunan reportio unrhyw symptomau maen nhw'n cael a mae hynny'n cael ei dilyn lan gan profi y rheini sydd yn dioddau o symptomau ac wedyn olrhain unrhyw cysylltiadau gyda'r pobl na sydd wedi testio'n positif a trwy wneud hynny mae'n amddiffyn ein teuluoedd, ein ffrindiau a'r cymunedau I ni'n rhan ohoni trwy gofyn i'r pobl na hunan ynysu a stopio'r haint yn ei tracs. Yn leol, mae'r system o olrain cysylltiadau yn gweithio ar y cyd rhwng Hywel Dda ag Iechyd y Gyhoeddus Cymru, Cyngor Sir Gar, Cyngor Sir Ceredigion wrth gwrs a Cyngor Sir Benfro. Ac ni'n gweithio gyda'r Regional Response Cell sy'n rhan o'r Bwrdd Iechyd ac mae hynny'n cael ei arwain gan ymgynghorwr iechyd y cyhoedd. Mae'r Regional Response Cell yn eistedd rhwng ni fel yr awdurdod leol a maen nhw'n rhoi cymorth I ni o ran gwybodaeth arbenigol I ymwneud â'r haint ac ni'n defnyddio hynny'n fawr wrth wneud penderfyniadau o ran pwy sy'n mynd I cael I ofyn I ynysu ag ati. Felly, nôl I Owain nawr I dechrau trafod y broses TTP o fewn y Cyngor Sir.
Hapus I fi cadw mlaen yn y Saesneg, de?
Wrth gwrs.
Right. Okay, so TTP works by identifying those who have symptoms consistent with COVID-19, enabling them to be tested while isolating with the wider family, friends, and their community. Tracing those individuals who've come into contact with the person who has tested positive on any occasion during a period beginning of 2 days, so 48 hours before they started experiencing symptoms, and requiring them to take precautions to self-isolate for 14 days in total. Providing advice and guidance, particularly where there are individuals who've tested positive or their contacts are vulnerable or at greater risk, and also by ensuring that the individual tests negative and the symptoms are not due to coronavirus. So that would be where the contact tracing system would end if they had a negative result, and the individual and their contacts could get back to normal routine as soon as possible.
Mae'r system olrhain cysylltiadau yn gweithio trwy dod i ben a adnabod y person hynny sydd gyda symptomau sydd yn cysylltiedig â COVID-19 gan galluogi ni cael nhw wedi testio gan ynysu oddi wrth y teulu, y ffrindiau a'r gymuned. Trwy olrhain yr unigolion hynny sydd wedi bod yn cysylltiad agos gyda'r person sydd wedi testio'n bositif mewn unrhyw cyfnod o 2 dydd cyn iddyn nhw dechrau cael symptomau ac gofyn iddyn nhw cymryd mantais o'r gofyniad i hunan ynysu am 14 dydd. Ni hefyd yn rhoi cyngor i'r unigolion rheini sydd wedi testio'n positif yn enwedig os mae'r cysylltiadau rheini gyda gofynion iechyd arbenigol neu maen nhw ar risg fwy. Ac yn ogystal, ni yn gwneud yn siŵr os yw unigolyn yn testio negyddol a bod y symptomau ddim o ganlyniad i coronavirus, bod y person a'i rheini yn cael gwybod nag e coronavirus o ddanyn nhw a bod nhw'n gallu mynd nôl ati i fyw bywyd normal.
Okay, so the success of the TTP project relies upon individuals who are symptomatic, even where those symptoms are very mild, to report their symptoms straight away at the same time to self-isolate and advise their friends and family that they may have COVID-19. Easy and rapid access to testing so that everybody who needs a test can get one. This could be through a mass testing centre, community testing unit, mobile testing unit, or via home delivery, where they can administer the tests themselves. The success also relies on individuals to recognise their roles and responsibilities to help protect others and provide information in order for their contacts to be advised of the necessary steps that they need to take to protect themselves and their families. It also relies upon contacts to self-isolate when advised, even if this is on several occasions. Also relies upon providing the right support for those who need to be self-isolating.
Draw ata i. So mae llwyddiant y system olrhain cysylltiadau yn dibynnu ar bod pobl sydd yn symptomatic, hyd yn oed os yw'r symptomau yna ddim yn rhai gryf iawn i ddod i ben a rhoi wybod i ni yn syth ar yr un pryd i hunan ynysu ac i rhoi cyngor i'w ffrindiau nhw a'r teulu efallai bod COVID-19 arnyn nhw. Mae hefyd yn dibynnu ar hygyrchedd y testio, felly bod pawb sydd angen test yn gallu cael un. Gall hyn fod trwy un o'r canolfannau testio neu un o'r canolfannau testio mawr, enghraifft mae un i gael yn Sir Gyfyrddin, neu mae community testing centres, so lleoliadau testio fewn y gymuned, mae un i gael yn Aberystwyth trwy lle maen nhw'n gallu gofyn am test i hunan gytre. Mae hefyd yn dibynnu ar unigolion i ddeall y pwysau sydd arnyn nhw i amddiffyn bobl arall ac i rhoi y gwybodaeth i'r unigolion sy'n cysylltu gyda nhw i wneud yr olrhain cysylltiadau o'r camau nesaf sydd angen cael eu cymryd i amddiffyn hunan a'r teuluoedd. Mae hefyd yn dibynnu ar bod y cysylltiadau yma yn hunan ynysu pan maen nhw'n cael eu ofyn, hyd yn oed os yw hynny yn digwydd ar sawl achysur ac mae'n dibynnu ar cyngor priodol yn cael ei rhoi i rheina o beth sy'n cael ei olygu gan gofyn i bobl hunan ynysu.
Okay, and now to the crux of it really, what we're here for. How do people responsible for community centres, how can you help us in the track and trace team So as people are increasingly visiting the same places as others, businesses operating in sectors where there is a higher risk of spreading the coronavirus have a key role to play in supporting contact tracing and keeping Wales safe. All businesses that are open to the public should have in place strict systems to comply with social distancing in all locations at all times, and should be following staying safe at the workplace guidance. Workplaces and premises open to the public are required under Welsh law to take all reasonable measures to minimise the risk of exposure to coronavirus. The starting point is preventing physical interaction within a 2-metre distance, and especially where this is not reasonably practicable, other measures to minimise close face-to-face interaction are required, such as the use of protective screens, rearranging furniture and other fittings, controlling the flow of people, or wearing personal protective equipment. This will minimise the need for test, track, trace and protect service initiating the contact tracing process if a member of staff, customer or visitor to your premises test positive for coronavirus. Regulation 12 of the Health Protection Coronavirus Restrictions, number 2 Wales Regulations 2020, requires reasonable measures to be taken to minimise the risk of exposure of coronavirus on premises open to the public and on any premises where work takes place, as well as to minimise the spread of coronavirus by those who have been on the premises. So Regulation 12 provides information about what those reasonable measures are, depending on the circumstances and what those may be.
Great. Draw at I. Yes, should gall pawb sy'n ma heddiw helpu o ran yr ochr olrhain cysylltiadau? Wel, wrth i fwy a fwy o bobl mynd mewn i un o'r lleoedd ag eraill, mae gan fusnesau sy'n gweithredu mewn y sectorau lle mae'r risg uwch o ledaenu'r coronavirus, sef rhai o'r amgylchiadau sydd gyda ni fan hyn yn y sector, rhan allweddol o ran cefnogi'r broses. So dylai pob busnes sy'n agored i'r cyhoedd rhoi trefniadau llym ar waith i gydymffurfio gyda rheolau pellter cymdeithasol yn pob lleoliad ar bob amser, a mae rhaid iddyn nhw dilyn y canllawiau cadw ddiogel yn y gwaith. Mae'n ofynol o dan y gyfraith Cymru i weithleoedd a mangreuoedd sy'n agored i'r cyhoedd gymryd pob cam resymol i leihau y risg o ddod i gysylltiad â'r coronavirus. Y maen cychwyn i'w adael rhyngweithio corfforol o fewn pellter o 2 fetr, ac yn enwedig lle nad yw hyn yn rhesymol, mae angen mesurau eraill i leihau'r rhyngweithio agos wyneb yn wyneb, enghraifft trwy defnyddio sgriniau diogelu, aildrefnu'r dodrefn a ffitiadau eraill, rheoli llif bobl neu wisgo offer diogelu personol, y PPE hynny yw. Bydd rhain yn lleihau'r angen i'r gwasanaeth profi olrhain diogelu, y TTP, i gychwyn y broses o olrhain cysylltiadau yn y lle gyntaf. Os bydd aelod o staff, cwsmer neu ymwelydd ag unrhyw fangre yn cael prawf positif am coronavirus. Felly, fi'n meddwl eist i mlaen o wain i siarad am rheoliadau. Mae rheoliad 12 o'r Health Protection Coronavirus Restriction Wales Regulations yn gofyn am y reasonable measures mae i gael ei gymryd i atal y risg o coronavirus. Un o'r mesurau arbennig yma yw i casglu gwybodaeth am pob person sydd wedi dod i'r fangre, ac mae'r rheini wedyn yn gofod cael eu cadw am 21 dydd er bwrpasion rhoi hynny i unrhyw un o'r canlynol, sef Welsh Ministers neu swyddog iechyd cyhoeddus, neu person sydd wedi cael ei penodi gan y Llywodraeth leol i cysylltu â person, sef contact tracers there.
Okay, yeah, I'll just backtrack slightly just to cover what Ed mentioned there about one of the particularly important reasonable measure that we have to take, and the businesses have to take, is collecting contact information for each person at the premises, or in relation to persons from the same household. If that's the case, if it is one household, it'll just be one representative from that household that we'd be requiring in that case, and retaining that information for 21 days. For the purpose of providing it to any of the following upon request. So it could be the Welsh ministers, a public health officer, such as Edward and myself, or a person designated by the local authority in whose area the premises are located to process the information for the purposes of contacting persons who may be exposed to coronavirus. We know them locally as contact tracers, who work in the team with both Ed and myself. So a little bit more on the contact information then. So in relation to a person at the premises means the person's name and information sufficient to enable the person to be contacted, to inform them that they may have been exposed to coronavirus at the premises. So this would include a telephone number and the date and time at which the person was at the premises. So by adhering to these regulations, by undertaking reasonable measures to maintain records of staff, customers and visitors, and sharing these with the NHS Wales Test, Trace and Protect service when required, you and the information that you provide will help identify people who may have been exposed to the virus, and people who may also be asymptomatic and are not yet displaying symptoms. So by doing this, you'll be able to help contain any outbreaks or clusters, and it'll be crucial to reducing the spread of coronavirus, thus protecting the NHS in Wales and ultimately saving lives. It will also help support the country in returning to and maintaining a more normal way of life. So Ed, I'll pass it back over to you.
O, na i ofyn, gallu di cario ymlaen i'r sesiwn nesaf?
Yeah, of course. Yeah, no problem. So if I go into a bit more information and detail about what information needs to be collected. So as I mentioned earlier, is information sufficient to be able a person to be contacted to inform them that they may have been exposed to coronavirus? So for staff and volunteers assisting in an event, for example, this would include the names of the staff who worked at the premises, a contact telephone number for each member of staff, the dates and times the staff were at work. And then another example would be visitors and participants to an event. So again, the names of the customers of visitors, or if it was a group of people forming a household or an extended household, the name of one member of the household, which we would call the lead member in this case. A contact telephone number for each member, each customer or visitor, or again, for that lead member of the group. And also what's very important is the date of visit and arrival, and also the time of departure. If not collected in advance, this information should be collected at the point that the visitor enters the premises. You should record the information digitally if possible, but a paper record is also acceptable. You should collect staff, customer and visitor information in a way that is manageable for your establishment. If you have a large booking, for example, at a restaurant, you only need to collect the name and telephone number of the lead member of that party, and the number of people in the party is also a good idea as well. Remember that the onus is on the business or the person responsible for the premises, not the customer or the visitor. And also, although it's acknowledged that in certain circumstances, this may be difficult, but recording the departure times as well as arrival times is also required. This would also include staff shifts. So it would not just be for visitors, it would also be for members of staff when they arrive and when they depart. Purely the purpose for this is so that we can limit the number of people who will need to be contacted via the contact tracing team. For example, if you took the names and the names and dates of arrival of everybody who attended a restaurant or the community centre for that day, then we'd need to contact every single one of them. But if we knew that there was a time frame involved where a potential symptomatic individual had been at the premises, we might be able to limit the number of people that we need to contact as a result of that. So arrival and departure times are very important.
Okay.
Ti'n moyn?
Ie, na i neidio mewn fan hyn. Ie, so jyst i gadarnhau pa wybodaeth sydd angen ei gasglu. Mae eisiau casglu digon o wybodaeth i allu cysylltu â'r person hynny i roi gwybod y gallai fod wedi dod i gysylltiad gyda'r coronavirus. So o ran staff neu o ran unrhyw person sy'n helpu mas o fewn unrhyw digwyddiad sy'n digwydd yn y canolfannau, mae eisiau gwneud yn siŵr bod ni gyda enwyr staff sy'n gweithio, rhifau ffôn cyswllt ar gyfer pob aelod o staff, a dyddiadau ac amseroedd gwaith y staff hynny hefyd. Ac wedyn o rhan ymwelwyr neu cwsmeriaid, mae eisiau cadw cofnod o enwau'r cwsmeriaid i gyd, neu os oes grŵp o bobl sydd yn rhan o'r un aelwyd, wedyn enw un aelwyd, yr aelwyd fwy o blaen llaw, y lead party o ran hynny, a gyda chi ffôn cyswllt ar gyfer pob un cwsmer, gyda dyddiad yr ymweliad a'r amser cyrraedd a gadael. Nawr mae gyda lawer o fusnesau systemau'n barod i gyfnodi manylion eu cwsmeriaid, efallai bod y gwybodaeth yma wedi cael ei casglu o flaen llaw, efallai bod ticedau wedi cael ei gwerthu a bod y gwybodaeth yna gyda chi yn barod, ond mae rhaid cofnodi'r gwybodaeth yma un ffordd neu'r llall, a gallech cofnodi'r gwybodaeth yn ddigidol os oes modd, ond mae cofnod papur yn derbyniol hefyd. Dylech casglu gwybodaeth ynghylch staff, cwsmeriaid ac ymwelwyr mewn ffordd a mae modd i chi'ch sefydliad ei rheoli yn dda. Os bydd grŵp mawr o bobl, dim ond enw a rhif ffôn, aelod arweinol y grŵp sydd angen i chi gasglu jyst i garanau hynny eto. Cofiwch mae cyfrifoldeb y busnes neu'r person sy'n PR sydd yn gyfrifol am yr adeilad neu'r fangre sy'n gyfrifol am wneud hyn nag i'r cwsmer neu'r ymwelydd. So, ni yn cydnabod gallai fod yn anodd mewn rhai amgylchiadau cofnodi amseroedd gadael yn ogystal ag amser cyrraedd. Mae'n rhwyddach yn amlwg cael cofnod o amser cyrraedd yn ar amser gadael, ond ni'n trio wneud hyn gan ein bod ni yn ynysu yr amser a'r nifer o unigolion ni'n edrych amdanyn nhw o ran track and trace. Os ni'n gallu cadw'r pobl sydd wedi ymweld â'r safle mewn carfan arbennig, wedyn dim ond y rheini sydd o diddordeb i ni fydd yn gorfod hyn yn ynysu. Sy'n ni'n gorfod gweud bod pawb oedd wedi dod i'r safle hynny ar diwrnod penodedig yn gofod hyn yn ynysu, byddwn ni'n gofod ffonio lot rhagor o bobl na sy'n ni'n gwybod yn ei gywir dim ond pobl o fewn rhyw awr o'r unigolyn sydd mewn cwestiwn sydd yn gofod hyn yn ynysu, fydd o fydd fawr i ni i cael y gwybodaeth ychwanegol na. So fydde hwnni'n peth da sy'n ni'n gallu cofnodi'r amser yn ogystal â'r dyddiad a'r rhif ffôn.
Okay, so everybody here today will play an important role in helping your staff, customers and visitors by supporting them to understand the value of the NHS Wales Test, Trace and Protect service. When collecting the details, you need to make clear to your customers why this information is being collected, explain what you intend to do with it, and it may be shared with us in the TTP service. You could do this, for example, by a verbal explanation on your website or display a notice at your premises. Material is available to help you do this, although please be aware that some people may need additional support in accessing or understanding this information. Sharing details with us in the TTP service will support our efforts to control the spread of the virus, as mentioned previously, in the circumstances set above, and it is also a requirement under Regulation 12 of the Health Protection Coronavirus Restrictions Regulations. We ask that you encourage individuals to share their details and help them understand the reasons why they are required. If the individual does not want to share their details, share the details with you. You are under a duty to collect those details, so therefore they should not be allowed into the premises. You should hold on to your records for 21 days for each separate incident in where staff, member, customer or visitor has been onto the premises. This covers the typical maximum 14-day incubation period for the virus and adds an additional 7 days during which people may be infectious after the onset of their symptoms. This will allow for testing and contact tracing should it be required. After the 21 days, this information must be securely disposed of or deleted. When deleting or disposing of data, you must do so in a way that does not risk unintended access. For example, using cross-cut shredders to dispose of documented paper documents instead of disposing in public bins, and ensuring permanent deletion of electronic files. The data you are collecting is personal data, and under the GDPR, data protection regulations, then you are the data controller for that data. This means that you have certain legal obligations in handling that data, and you will need to be satisfied that you are complying with the GDPR regulations so to protect the privacy of your staff, customers and visitors. Do you mind cymryd ymlaen am hynna?
Iawn, na i, wrth gwrs. So mae gyda pawb sydd fyny'n heddiw rôl bwysig o ran helpu eich staff, cwsmeriad ac ymwelwyr i ddeall gwerth y gwasanaeth profi olrhain diogelu Gig Cymru. Wrth gasglu'r manylion yma, bydd dwi angen i chi gwneud yn glir eich cwsmeriad pam mae'r gwybodaeth hwn yn cael ei gasglu. So, mae eisiau chi egluro'r hyn rydych chi'n bwriadu wneud â hi a dweud gallech chi rhannu hyn gyda'r gwasanaeth profi olrhain diogelu. Gallwch chi wneud hyn enghraifft trwy roi esboniad ar lafar neu ar eich gwefan neu dangos hysbysiad yn eich mangre neu yn yr neuadd mewn cwestiwn. Mae deunyddiau ar gael i ymwneud â hyn ac mae hyn wedi cael ei rhoi i gael ei rhannu ar wefan y cyngor trwy'r link hynny. Mae hefyd i gael ar wefan Welsh Gov. Os ydych chi'n dilyn y links a edrych ar y link i cadw cofnodion staff a cwsmeriad, mae gwybodaeth ar gael fyna. Gallwch defnyddio hynny i roi posteri lan ag ati o fewn eich neuaddau ag ati. Bydd rhan y manylion yn helpu ein gwasanaeth ni o ran profi olrhain diogelu i rheoli lledaeniad y feirws. Ac o dan yr amgylchiadau ni wedi sôn amdanyn nhw heddiw, mae'n ofynnol o dan rheoliad 12 o rheoliadau diogelu iechyd Coronavirus Cymru i sefydliadau a busnesau casglu a chadw'r gwybodaeth. Rydyn nhw'n gofyn i chi annog unigolion i rhannu manylion a'i helpu i ddeall y resymau pa mae angen. Dylech ddweud wrthynt mae dim ond os bydd achos clwstwr neu nifer o achosion newydd o'r coronavirus sy'n cael ei holfrain yn eich mangre y caiff eu manylion nhw ei ddefnyddio. So mae hynny'n peth pwysig sy'n angen canolbwyntio arno a rhannu gyda'r pobl sy'n dod i ymweld â'r safle. Bydd y gwasanaeth profi olrhain diogelu yn defnyddio'r gwybodaeth hon i ganfod a allai'r unigolyn neu unrhyw un yn ei grŵp bod wedi dod i gysylltiad gyda'r feirws. Ac os yw'r unigolyn dal yn anfodlon i rhannu ei fanylion a bod dyletswydd arnoch chithau i gasglu'r manylion hynny, ni ddylech chi caniatáu i'r person hynny ddod i'r mangre. Dylech cadw'r cofnodion fel mae wedi gweud am 21 diwrnod o dyddiad pob ymweliad unigol ar fangre. Mae hynny o ran aelodau staff neu unrhyw ymwelydd arall. Mae hyn o ganlyniad i'r cyfnod hiraf ar gyfer magu'r feirws yn y corff, sef 14 diwrnod fel arfer, a wedyn 7 diwrnod ychwanegol pan allai fod pobl yn heintus ar ôl i'r symptomau ddechrau. Bydd hyn yn golygu bod modd profi ac olrhain cysylltiadau os bydd angen ni wneud hynny de. Ar ôl 21 diwrnod, mae'n bwysig iawn bod chi'n dileu'r gwybodaeth hwn neu gael gwared arni mewn ffordd ddiogel. Rhaid i chi wneud hynny mewn ffordd lle nad oes risg, y bydd pobl eraill yn gweld y data'n anfwriadol. Hynny yw, trwy defnyddio peiriant rhwygo, sef shredder, i rhwygo'r dogfennau papur, yn hytrach na roi mewn biniau yn amlwg, a sicrhau bod unrhyw ffeiliau electronig sydd gyda chi yn cael ei dileu am byth. Mae rhaid pwyntio mas hefyd yn amlwg taw data personol yw'r data ydych chi'n mynd i bod yn cynulo ac o dan GDPR, chi yw'r rheolwyr data fan hyn. Mae rhwymoedigaethau i gael rhwymoedigaethau cyfreithiol penodol wrth ymdrin ar data hwnnw, a bydd rhaid i chi cydymffurfio GDPR mwyn diogelu preifatrwydd eich staff, eich cwsmeriaid a chymwelwyr. Mae swyddfa'r Comisiynydd Gwybodaeth, yr ICO, gyda fwy o nodiadau pellach nag ni'n gallu mynd mewn iddyn nhw yn y trafodaeth yma heddiw. Felly, cyfeiriwn i chi at wefan yr ICO. Eto, mae link i gael ar gwybodaeth y Cyngor Sir ar y portal sydd wedi cael ei rhoi er pwrpasion hynny. Nawr te, mae sail arbennig o olrhain cysylltiadau yn galluogi y data yma gael ei cymryd, a hynny ydy, bydd y cyhoedd y cesglir y data yma, mwyn darparu ymateb iechyd gyhoeddus i leihau'r risg o lledaenu'r coronavirus. So mae hynny'n sail gyfreithlon ar gyfer prosesu'r data personol o dan erthygl 6.1. Felly, fi'n meddwl bod fi wedi mynd dros popeth sydd wedi cael ei trafod o wain nôl at y ti.
Yeah, just I'll go back briefly just to mention about Article 6.1c there. Basically the coronavirus restrictions, Wales regulations require certain organisations and businesses to request contact information from your staff members, customers and visitors, and to share it with us in the TTP service for the purposes of public health functions. Now that's the important bit. So this, together with the fact that the collection of data is in the public interest and is providing a public health response to minimise the risk of coronavirus spreading and transmitting, this forms a lawful basis for processing that personal data under Article 6.1c, as mentioned by Ed just now. The GDPR requires that any personal data you collect is processed fairly and transparently, as well as lawfully. If it has been collected for contact tracing purposes only, it must be used for only those purposes, basically, and not for purposes including marketing, profiling, analysis, or any other purposes like that. And as Ed mentioned, that there's far more information about GDPR on the ICO's website, which can be found if you go to the information on our Ceredigion County Council's webpage. So this service, in terms of the TTP service, will ask for the records only where necessary, either because someone has tested positive for coronavirus and has visited your premises as a place they have worked or as a customer or visitor, or because they've been identified at the location of a potential cluster or outbreak of coronavirus. If asked to do so, you are required to share the information of staff, customers and visitors with the TTP service as soon as possible. You should not share the information that has been collected for this purpose with anybody else. So that hwnna'n pretty much symo fel an yn credu ochr fi. So.
Iawn, jyst I benni off de, bydd y gwasanaeth yn gofyn am y cofnodion eich wedi casglu, dim ond pan fydd hynny'n angen rheidiol. Naill llai oherwydd bod rhywun sydd wedi cael canlyniad positif am y coronavirus wedi cael ei restru yn eich mangrau chi, neu neu achos falle bod clwstwr neu nifer achosion penodol wedi cael ei olrhain i'r safle ydych chi'n gyfrifol amdano fe. Mae'n ofynnol i chi rhannu gwybodaeth am staff cwsmeriad ac ymwelwyr a gwasanaeth profi olrhain diogelu gig Cymru cyn gynted ac sy'n bosib. Felly, na pam bod angen i'r manylion yma cael eu cadw mewn ffordd sy'n gallu i cael ei reporto nôl mewn gloeg sy'n bosib. Ni ddylech rhannu'r gwybodaeth sydd wedi cael ei casglu at y diben hwn. Ni ddylech rhannu'r gwybodaeth sydd wedi cael ei casglu at y diben hwn a neb ag unrhyw un arall yn amlwg. Fydd gwasanaeth profi olrhain diogelu gig Cymru yn trin y data unol a'r GDPR ar bob cam o'r broses. Felly, gallai unrhyw ddefnydd arall yn neud ohoni enghraifft pe bai busnesau cysylltu â chwsmeriaid yn torri, yn cael ei cysidro fel achos o torri'r rheoliadau hynny. Felly, dyna fe o rhan y gwybodaeth sydd wedi cael ei gasglu. Ac os oes unrhyw cwestiynau, if anybody has any questions, we are welcome to receive those now.
Diolch yn fawr iawn. Thank you very much, Ed and Owain. Mae cwestiynau wedi bod yn dod trwyddo. We've been keeping an eye on some of the questions that have been coming through. A mae fe yn cyfle da i ni atgoffa pawb am y proses. It's a really good opportunity, isn't it? Remind everybody of the process. And while we're going through some of the questions that have been submitted, I'd just like to launch the poll. Tra bod ni'n mynd trwy'r cwestiynau, newn ni cychwyn y cwestiwn nathon ni addo i chi. We'll share the question that we promised you that we want all attendees to answer following the presentation. Now, one question about if you suspect that you may have any COVID type symptoms, who do you report that to? Good opportunity to clarify that query. Ed or Owain?
Yeah, yes, I'll jump in there. So if anybody has symptoms of coronavirus, they are required to self-isolate immediately, and they're required to book a test in the first instance via the 119 number. I drosi hwnna'n Gymraeg, os oes unrhyw un ydi oedd y symptomau, mae rhaid iddyn nhw hunan ynysu o'r cychwyn cyntaf gyda'i teulu a holi am prawf trwy cysylltu gyda rhif 119. Ac o hynny ymlaen wedyn, os deiff y canlyniad yn ôl yn bositif, bydd rhywun o'r swyddogion olrhain cysylltiadau yn cysylltu gyda'r unigolyn hynny, a fydden nhw yn dechrau ar y broses o track and trace. So just to go back and confirm, once the application has been made for a sample and that swab is returned and analysed, if it was to come back positive, then that individual would enter the track and trace system and would be contacted by one of the contact tracing officers and advisors.
Diolch, Ed. Cwestiwn arall gyda ni. We have another question. Just trying to track that question down now. Are the contact details for all testing facilities in Ceredigion on the local authority website?
No, they're not on the website. People shouldn't make their way there, obviously, without making an appointment. That's the important thing. If anybody is experiencing symptoms, they call the 119 number, as mentioned earlier, and then they will be contacted by triage, who will run through the symptoms to start with. And then following that, if they are considered eligible for a test, they will be told where tests are available and at what time. So at that point, it will become obvious where to go.
Cwestiwn arall diddorol o Hannah, another really interesting question from Hannah about those who are homeless ynglyn â'r sawl sy'n digartre. If we run a homeless meal, how do we deal with track and trace if people do not have contact numbers?
Very interesting question.
Yes.
My understanding was that most people without addresses were taken into accommodation, certainly at the height of lockdown. How this has panned out, I'm not sure. But it is a very good question. We would need to certainly have a single point of contact. That would probably be the best way of negotiating the situation. So if names are collected, maybe without telephone numbers for now, then we would make further inquiries with the person that was organising the event and making every effort to track down any individual that presents without a telephone number. It would be a case of working through that sort of scenario. Yes, the more detail that we can collect, whether it's no telephone number, whether it's an address that we might be able to get the individual at that they drop into occasionally even, that would be useful.
Yn symud ni yn neis iawn i'r cwestiwn nesaf that links very nicely to our next question from Sue, who's asking about the process of collecting details. Is it the responsibility of the activity leader to collate that detail, or the whole trustees? And I think in answer to that question about homelessness, then it's quite clear that the responsibility lies with whoever's arranging the activity, whoever's drawing those people together. Because if you do then need to follow up with the whoever's organising the activity, then it's quite clear. It would be really difficult and impractical, I think, for hall trustees or the management committees of community centres to do so.
Yeah, just to jump in, I think everybody shares the responsibility to a certain extent. It is certainly incumbent on the individuals that, the trustees for the halls, to outline the requirements that to maintain some form of detailed recording, and for that responsibility to communicate it to anybody any individual that's organising events, for example. So I sort of foresee it being a collaborative process between anybody that has an interest in the event and the location where the event is taking place, with the main objective being to harvest that information so that we can connect with any individual if a person came back positive at that event.
A mae'n bwysig yn dweud bod pwy bynnag sy'n rheoli'r adeilad yn atgoffa'r sawl sy'n trefnu gweithgareddau I gadw'r rhestr. I think it's really, really important that whoever manages the building and owns the building reminds those who are arranging the activities that they need to be keeping these details and they need to be keeping the contacts. A mae yna cwestiwn wedyn o Pennant sy'n holi ambwti aelodau. Question from Pennant about registered members, and I think, Anne-Marie, from the presentation it's quite clear that a membership register is useful, but it really is about the individuals that actually are in a building at any one moment in time. So it's really important to keep a register of the activity itself, and as you were saying, Edward and Owain, really important as well that we have some kind of a timeline, a time scale around that, because it's easier to do some of that tracing. So although we understand that you might have a list of registered members, it really does need to be a list of the individuals that have attended a particular event or activity.
Yes, Hazel, just to come in there as well, it's obviously there has to be a mode of transmission for COVID. It doesn't just materialize from space. So in terms of having that timeline is very, very important. So yes, a list of registered members would be very, very helpful. But if we were then to get an incident at Pennant, for example, we'd need to then narrow it down, and we wouldn't want to be contact tracing people who haven't been there for 48 hours. You'd want to know a specific time frame as to when those individuals were there. So yeah, no, just to back up what you were saying, yeah, that is very important.
Cwestiwn diddorol hefyd o Carol, really interesting question from Carol. If somebody comes into the centre and develops symptoms while they're there, obviously need to close and then deep clean, but who do you then report that kind of incident to? Who do we call? I would expect that we would all need to self-isolate and anyone who had been at the centre at the time.
Well, I think this hammers home the importance of ensuring that the halls, etc., are set up in such a way that avoids any contact with any individual that would become symptomatic while at the venue. I think, you know, that's an important starting point. The whole idea is multi-layered in the battle against COVID. So if the space was set up in such a way that allowed 2 meter social distancing for all individuals that were attending, first of all, that limits the potential for people to have contracted COVID from any person that became symptomatic while in the space. So it would be an interesting, that would be the, you know, the important starting point. Going on from there then, the individual should be signposted to return home, obviously, and self-isolate until the test result is clear. Then the track and trace scheme would kick in if that individual did return a positive result. That's how it would pan out in that situation.
Yes, just to bolt on to what Ed was saying there as well, is it would only be that individual who became symptomatic that would be required to self-isolate at that time, and any household members. You know, we wouldn't extend the isolation until that positive result came back. It could return negative, and then that person could come out of isolation. But it's important that we don't go steps too soon, isn't it? You know, that, you know, that's why it's important, as Ed was saying, to try and limit the amount of contacts within the setting in the first place. But as the initial stage would be, that individual would be required to self-isolate and get a test, but not anybody else who they'd had contact with at that stage.
Diolch yn fawr iawn, thank you. And interesting question from Joan, and maybe some members of the panel would like to chip in on this one as well. Cwestiwn diddorol o Joan ynglyn â cyfrifoldeb eto. Who is responsible for collecting data in a community hall run by volunteers? Mae hwn yn mynd â ni nôl yn diwedd i'r gweithgaredd hefyd. This kind of takes us back to the activity and how, you know, most halls are run by volunteers, and it's not really practical for maybe the management committee to be taking the details. So if it's the responsibility of those who are arranging the activity, that makes it easier. But if neither the hall committee nor the people arranging the activity can commit to keeping and collecting those details, then the question is, should the activity be happening in the first place? Is that fair? Odi hwnna'n deg?
I would agree that it is incumbent upon anybody that's putting together an event to ensure that the standards are in place, and I would question that there must be somebody responsible to set up the event in a way that makes it safe for people to attend, and the correct collecting of data is only another arm of that planning process, and ensuring that the event is safe for all to attend. So if that can't be facilitated, then I would suggest that the event doesn't go ahead, to be blunt.
Yeah, it's a requirement, isn't it? Mae fe'n ofynnol ag yn hanfodol. Manon a Teleri, fi'n gwybod bod chi hefyd wedi bod yn edrych ar y cwestiynau. I know that Manon and Teleri have also been keeping an eye on the questions. Have I missed anything that is, I know we've had a few questions about wider issues to do with village halls and restarting activities, but have I missed anything that is specifically related to the test, trace and protect process? A dwi wedi anghofio unrhyw beth? Yn iawn, felly...
Ymddeiriadau am mynd o'n hwyr, apologies for being late to the meeting. From what I can see, because I've had a copy of all the questions so far, you've answered all the questions relating specifically to track and trace.
Excellent.
A number of questions about other Pacific, but we'll answer those direct to the individuals.
Diolch, Tereri, thank you. A diolch I Ed a Owain. Thank you very much to Ed and Owain for your time this afternoon. And if any of the attendees do have any follow-up queries or questions, or if anything isn't particularly clear, then do contact us. Cysylltwch â ni yn Cafo, a wedyn allwn ni rhannu'r cwestiynau yna a'r ymoliadau yna gyda Edward a Owain. If you contact us at Cafo, and Teleri will pop the contact details up in the chat column now, then we can pass on any of your queries to Ed and Owain. Mi wnawn ni hefyd ychwanegu unrhyw gwybodaeth defnyddiol ar gwefan y cyngor. We will also upload in due course any useful information, templates, or answers to regular questions on the Ceredigion County Council website. Diolch yn fawr iawn I chi, thank you very much. Nawr, gan bod ni'n canolbwyntio ar bobl, seeing as we're focusing on people this afternoon, Laurie, would you be willing to tell us a little bit more about some of the services that Ceredigion County Council offer, and some of the timelines around reintroducing services and the decisions that have been made? Laurie, nawr cyflwyno ti I weid ychydig yn rhagor ynglyn â gwasanaethau'r y cyngor, sir.
Diolch yn fawr, Hazel. Pnawn da I chi gyd. Laurie Evans dwi'n gweithio I Porth Cymorth Cynnar sy'n rhan o gyngor Sir Ceredigion. I work for the Early Help Service, which is located within Porth Cymorth Cynnar and is part of Ceredigion County Council. So sonia I just ychydig am safbwynt rhai o wasanaethau'r cyngor Sir gan gynnwys rheini a fydde fel arfer felly'n defnyddio cyfleusterau Cymunedol I gynnal gweithgareddau ac yn y blaen. Fel mae hwn yn sefyll ar hyn o bryd ac mae'r trefniadau hyn yn cael ei adolygu bron yn ddyddiol. I'll mention just a little bit about the County Council's perspective in regards to some of the services and activities which I suppose would ordinarily use and utilise community venues and spaces to operate. And this is as it stands at the moment, with arrangements being reviewed almost daily, hoping that it might give you some context or understanding of the local authority's position, perhaps if you're in a position whereby you're thinking about restarting or reopening certain facilities within current guidelines, of course, but you're not quite sure. Y bwriad o wneud hwn yw I gynnig chydig o gyd-destun I chi a cynnig chydig o enghreifftiau falle I chi os bod chi'n y sefyllfa lle ydych chi'n ystyried o fewn eich mudiadau a'ch grwpiau chi pa wasanaethau ydych chi'n mynd I ail gychwyn neu bido a bod chi'n cychwyn meddwl am hynny. Wrth gwrs wrth weithio o fewn y canllawiau sydd gyda ni ar hyn o bryd. So felly gychwyn, o ran gwasanaethau I blant pobl ifanc a teuluoedd o fewn y cyngor sir. Rydym wedi penderfynu am y tymor hwn y byddwn ni'n parhau gyda gwasanaethau rhithiol, ble bynnag sy'n bosib, yn enwedig cyrsiau neu fforymau lle mae fel arfer gofyn I fwy nag un teulu ddod at ei gilydd. Dyn ni ddim yn bwriadu denu llawer o bobl mewn I un man o gwbl eto. Rydym yn ddiweddar wedi cael caniatadu ail gychwyn agweddau penodol iawn o'r gwasanaethau ni I deuluoedd a'i sonia ychydig am sut mae hwnna'n edrych nawr. In regards to maybe services for children, young people and families within the local authority, we've decided that this term that we will continue with virtual services wherever possible, and certainly for groups, courses and forums where we would ordinarily expect more than one family to come together and so on. We wouldn't be requesting or encouraging that just yet, whereby more than one family will gather at any one space. We've recently had approval to begin some very limited specific provision for children and families, whereby this looks very differently, as you know, to what it would have before. So na i ymestyn chydig fanna de. Rydyn ni wedi wneud, wedyn ni'n cychwyn trefniadau manwl o ran paratoi fedru cynnal apwyntiadau ar gyfer rhieni neu deuluoedd unigol o fewn nifer cyfyng o leoliadau penodol. Bydd yr appointments yma ar gael i rhieni a teuluoedd lle nad oes modd iddyn nhw gwrdd neu derbyn y wasanaeth neu gymorth yn rhithiol, a lle bod ni'n diffinio'r apwyntiad yma yn un hanfodol. Bydd pob appointment yn cael ei asesu o flaen llaw, wrth gwrs, gan gynnwys holiadur iechyd cyn iddyn nhw ddod i'r ganolfan neu man cwrdd, ac ar hyn o bryd byddwn ni ddim yn cynnal darpariaeth ar gyfer mwy nag un teulu ar un tro. Rydym yn ystyried, dyn ni wedi ystyried lleoliadau sy'n addas, lle mae modd cynnig appointments ar gyfer teuluoedd unigol, lle mae'n hanfodol. So, o ran yn gwaith ni o fewn y maes hwn, dyna safbwynt y cyngor sir. Rydym hefyd yn ystyried apwyntiadau allan yr awr agored, beth sy'n addas, a tra bod y tywydd yn caniatáu. Mae hyn yn golygu bod llai o risg wrth gwrs ac wrth i ni gadw pellter cymdeithasol tu allan. Just recap in English, we've made some detailed arrangements to be able to consider hosting appointments with individual families in selected council venues. These appointments will be for parents or families whereby they are not able to receive the support virtually and where it's considered an essential appointment. So each appointment, of course, will be risk assessed beforehand, including a health questionnaire, before they make their way to the venue or the meeting point, and there certainly won't be any crossovers between families or individuals. So not every venue will reopen for this, of course, only a limited number of spaces that we've identified suitable and essential. So we're also considering appointments in outdoor open spaces to reduce that risk as well. Yn symud ymlaen felly i enghraifft arall y fydde'n gyfarwydd i chi, i rai ohonoch chi neu sy'n godebyg felly i sut mae rai o'ch grwpiau chi'n rhedeg yw o bosib yn fforymau i ofalwyr neu'r cynllun GP Exercise, the GP Exercise Referral Scheme, y rhaglen NERS yng Ngheredigion. Mae'r gwasanaethau a'r grwpiau hyn yn naturiol yn debygol o ganolbwyntio ar unigolion sydd o'r ystod oedran neu rheini sy'n fregus o bosib, rheini sydd wedi bod yn cysgodi ar sail meddygol ac felly yn fwy agored yn amlwg i niwed yn sgil y feirws. So o ran y cyngor sîn, ni fyddwn ni'n algydio mewn darpariaeth wyneb yn wyneb ar gyfer y grwpiau bregus hyn ar hyn o bryd, yn enwedig lle mae angen ystyried amgylchiadau yr unigolion a'r risg fydden nhw'n agored i wrth gwrdd ag eraill. Yn enwedig o dan do. Another example maybe which some of you might be familiar with or maybe similar to some of the groups that you cater for, maybe the carers forums or the GP exercise referral classes that typically would have before been hosted in community venues. Typically, they are services which work with and support individuals who may be deemed medically vulnerable. They may have been in the shielding category. And at present, we will not be resuming face-to-face work with these individuals of these vulnerable groups, and that is due to the added risk that we've assessed in doing that. These arrangements, of course, across the board are reviewed regularly. Mae'r trefniadau mae'n cael ei arlygu'n reoledd iawn, ond i grynhoi, felly ar hyn o bryd, mae'r cyngor yn parhau flaenoriaethu gwasanaethau rhithiol beth sy'n bosib, yn enwedig gyda grwpiau o bobl bregus. Mae'n bwysig bod ni'n sicrhau bod ni'n rhoi digon o ystyriaeth i'r grwpiau hynny o bobl. I think probably just to summarise, it's the point that it's important to consider, of course, the buildings and the venues themselves, which we've already discussed in previous briefings, but a strong consideration also needs to be given to the groups of individuals or the individuals that you expect that will access the venue or the activity as well. And I think this needs to be as important as anything else, particularly if you're an organisation or a service which supports those that belong to the more vulnerable groups. Diolch.
Diolch, Lowri. Thank you, Lowri. And that brings us nicely to the end of the session. Mae hwnna'n dod â ni I gloi'r sesiwn. Just to recap, we've had just a few questions, and if we haven't been able to get back to your question directly, then we will follow up after this meeting. Os na bod ni wedi gallu'r ymateb i'ch ymoliad yn ystod y cyfarfod ma, mi newn ni gysylltu wedi'r cyfarfod. But there was just one point of clarification about reporting. If there was anybody within an activity that was symptomatic, then it's not the duty of the village hall, the community centre or the activity providers to contact the other individuals involved. The contact tracing team in Ceredigion will take on that role, will do that. Ydy'n bosib I cadarnhau, Ed neu Owain?
Sorry. Odi, I'ch chi'n hollol iawn, you're totally correct. Os oedd unrhyw un yn symptomatic yn ystod unrhyw un o'r digwyddiadau sy'n digwydd, fydde y person hynny yn gofod cael y cyngor I hunan ynysu a cael y prawf, ac o gynlyniad i'r prawf hynny'n dod nôl yn bositif, fyddwn ni yn cael gwybod amdani gyda'r system olrhain cysylltiadau. So just to recap in English, that any individual that experiences symptoms need to be signposted towards the need to take a test and to self-isolate along with their household until the result of that test is known. And once the result of the test is known, if it does come back positive, then the Test Trace Protect team will be in touch with that individual and will continue the contact tracing operation from that point forward.
Diolch, thank you very much. Mae yna gwybodaeth ar wefan y Cyngor Sir, mae canllawiau Llywodraeth Cymru a WCVA ar y wefan. The guidance, we're getting quite a few questions about different activities. The guidance from Welsh Government and WCVA are on the local authority website. We won't be producing any specific Ceredigion guidance. We'll be sticking to the national guidance. But we will be adding other interesting, useful documents. And we're also in the process, aren't we, Lowri, of uploading some documents and some of the recordings from previous sessions as well, so you can catch up if you haven't been able to join us. In terms of just very, very briefly, just as a reminder, just i'ch atgoffa chi, ar hyn o bryd, mae'r canllawiau yn cyfyngu unrhyw gweithgareddau tu allan I nifer o 30 o bobl, a unrhyw beth sy'n digwydd tu fewn i'r bubble o 4 cartre, 4 teulu. Just as a recap, at the moment, outdoor activities are restricted to a maximum of 30 people, and the panel can come in if I've misinterpreted anything. And indoors, people are still restricted to their bubbles of up to 4 households. But there are a limited list of permitted activities, which includes the delivery of public services and includes the delivery of voluntary and charitable activities. But it is vital that there is physical distancing within that space. So the numbers of people who are able to come together will be limited, and the type of activities would be limited, because holding meetings or having very few people in a small space wouldn't work with the 2-metre physical distancing. Mae'n hanfodol bod ni'n cofio bod rhaid I bobl fod 2 metr ar wahân pan maen nhw tu fewn. Felly na'r cynllawiau ar hyn o bryd, they are the current regulations. Efion, does dim byd wedi newid ers I fi cael golwg ar hwnna diwethaf. Nothing's changed, has it, Efion, since I last checked. This is the final session in our series of 3. Hwn yw'r sesiwn ola yn cyfres o 3. I ni yn fwy na hapus I drefnu sesiwn arall mewn ychydig wythnosau. Sesiwn I rhoi'r cyfle I chi I gyd drafod. This brings our series of 3 specific topic-based sessions to an end. But we are happy to arrange a 4th session for you, a more interactive session, for you to come together to discuss some of the challenges and some of the things that have worked really well in the reopening of your venues and the reintroduction of various activities. Felly mi fyddwn ni mewn cysylltiad gyda manylion y sesiwn na, ac os bod na unrhyw beth penodol I chi ise I ni I drafod neu I ystyried wedyn cysylltwch. So we will be in touch very soon with details of that more interactive session, but in the meantime, if you do have any topics that you do want us to cover in the future, then please let us know, stay in contact, cadwch mewn cysylltiad, diolch I chi am eich amser prynawn 'ma. Thank you for your time and your patience this afternoon, and we will be in touch with details of our next session, which will be more interactive. Cymerwch ofal and take care.